Hello, hi, my name is Samuel Ezerza for the SE channel. I want to welcome to my channel. Thank you for tuning in. Please subscribe and share as much as you can. Um, okay, well, this is going to probably be, like I said, anything to do with the coronavirus is always important. What's going on? Just be prepared. That's all. One of the reasons why I want to do this video, and I wanted to do this video, and I haven't done a video for the past week. I've been preparing. I only had like a month supply. Now I got like 2 months supply just in case, since it hit Italy so hard. And you guys also have to understand that Italy in the north has a lot of elderly, more people than the average. So it hit them hard. And let's say out of 100,000 people, what I've read, and like I said, I'm not a scientist. I mean, I'm not an expert in this. And when it comes to pandemics or virals or anything like that, um, I do have a science. I have a bachelor's of science degree, so I've taken organic chemistry and all that. I mean, I do have the base and all that. I mean, I can, I'm taking calculus and all that. But like I said, I have a science degree. So what I'm just about to tell you is I wanted to do a research on how are the hospitals going to be prepared for, let's say, millions of people coming just in case of this outbreak if it does happen. Okay, like I said, I'm not an expert, so if you guys don't agree, that's fine, and do your own research, that's fine. But I'm putting out the information, and if you guys don't like it, well, and if you think panicking, I'm not. I'm being prepared. Like right now, I'm taking some ginger tea. I bought some oranges for vitamin C. Got to take vitamin D also. It will boost your immune system. Now you got to understand, out of the 100,000 people, let's say 80, let's say 80% of them, it'll be like a mild flu or whatever. Like the old flu stuff. When you're in bed for a couple of days, 5 days, a week or two. And then the other 20%, it's they're going to be needing they need hospitalization. It's going to hit them really, really hard. About this coronavirus, it's how fast it's spreading. Like how fast. It's like one person can give it to 5 people or 6 people. It's not like the regular flu can give it to one person, maybe two. This go 5, 6, and it's spreading very fast. And now I'm being told that it hits the lungs, and then it comes back again. It mutates to something else, and then it goes after the heart or the brain or something like that. I'm not sure, but something it comes back again, just like any other flu or any viruses. Um, so look into that. Now, I want to do this video. Oh, by the way, buy some Greek yogurt. Okay, blueberries, for antioxidants. That it's good for colds. What else? Tomatoes, good for vitamin C. Just start eating now. Wild salmon. It's filled with zinc. Very important. Buy zinc vitamins, or just like vitamin D's or vitamin C's. Go out there. Nobody's talking about these things. Dark chocolate. Let's see. I wrote it down here. Green tea, also very, very good, and antioxidant. Boost the immune system. The green tea, spinach, good vitamin C, eggs, the egg yolks, vitamin D, garlic, well, whatever, debatable. You can have it. Apples, very good too. Ginseng tea, also very good. Treats upper respiratory tracts infection. I mean, I wrote it all down. Blueberries, antioxidants. Like I said, anytime you have antioxidants, which is good, it prevents the cough and colds. Now, it may not, like cure the, God forbid, the virus, okay? But at least it'll help something. It'll at least, it won't be as bad, probably. That's what I meant. So, I don't know. Buy ginger tea and oranges. Drink lots of water, by the way. Now, let's do this video here concerning if the hospitals, how ready they are. And by the way, I just want to say the AHA, which is the American Hospital Association, they brought in this expert. So it's not even their own view, but they brought in this expert on this webinar. They keep saying, throughout the read, that these are expert. They're not their expert, but these are experts they brought in on the webinar, putting out their views. So like I said, I cannot independently verify it, but look, it's Business Insider, and it's the AHA. Okay, so in February, webinar presentation hosted by the American Hospital Association expert laid out best guess estimate about, many Americans could be impacted. The projected it could be as many as 96 million cases, 4.8 million hospitalization, and half a million death, God forbid, which comes out to the same story as I told you. Let's say if 100 million, God forbid, 100 million are infected in the U.S. or around the world, let's say. And by the way, they don't give you a time. This could be like a year or maybe 2 years. I'm not sure. It doesn't say the time. It just says the amount of number. Okay, so uh, obviously, if you have 100 million and then 80%, so you have 80 million that will have a some sort of flu or heart flu, but they'll survive it. A couple of weeks in bed. I had some severe flus that last me 5, 6, 7 days. Really hard. I mean, my head was on. I mean, I wonder how this one is, but God forbid, I don't even want to know. Maybe we're all gonna catch it. Who knows? Who knows? But prepare. Get some. Drink some green tea now. Buy some broccolis. Boost the immune system. These are antiviral stuff. Like ginger tea, oranges. I wrote it all down. So 20 million, which I can do a count from 100 million. I'm not MSNBC or New York Times. Can't even divide. What is it? 500 million divided by what? 360, 315 or 20 million, whatever it is. A million. That was the biggest joke. But anyways, so they're looking at quite a bit over here. The question is, are they prepared? From this article, it doesn't say, but my personal view, I don't think they are. I mean, 100 million. I mean, that means 20 million. So can they handle 20 million at least? I mean, I figure the rest will be quarantined in their homes, I guess. Hospitals are bracing for millions of Americans to be hospitalized. Okay, the American Hospital Association will represent thousands of hospitals and health system hosted a webinar in February, which is members, hospitals, and health system. The presentation titled, what healthy leaders need to know, okay, about the COVID-19. And by the way, this is this guy, Dr. James Lawler, a professor at the University of Nebraska Medical. He put in his best guess, so it's a guess. Okay, so don't go crazy, calling him or whatever. It's just the best guess. That's all. Just the best guess, and this is his. It's his right to know. But we're talking about. Look, I'm sure the AHA, which is the American Hospital Association, represents a lot of professionals. They just won't bring any dummy. It's not like MSNBC bringing New York Times editors can't even add or subtract or divide or multiply. 4.8 million hospitalization associated with the novel. Okay, 96 million cases overall. This is our estimate, and half a million death. Okay, it doesn't say the time. When, could be a year, could be two. I don't know. But it's gonna be. What I want to see is this. Okay, what I want to see is like this. I want to see this. Look, I've taken science. I've taken some math courses, and I didn't go to the MSNBC, math schools. But if it goes up like that, it's too fast. That means the hospitals won't be able to handle it. This is okay. I mean, God forbid, still bad, but at least this is okay. But not like this. Then you have thousands of coming every day. They won't be able to handle that. And here it is, 2.5 doubling times every 7 days. So you can add it up yourself. Community, every wave is like it's 2 months. Community attack is 30 to 40%. Cases requiring hospitalization 5%. You guys can read it. I mean, it's the same thing that I just told you before. Prepare for disease burden roughly 10 times severe the flu season. You guys can check it up. I'm not making this stuff up. Like I said, it's this professor from Nebraska. He says it's his best guess. Okay, look, it doesn't hurt to go out and prepare yourself. I mean, you can buy pastas and rice and flour, peanut butter, freeze some bread, get some extra water, get yourself a few $100, even more if you have to, just get yourself prepared because you don't know what's going to happen right now. If there's a coronavirus case a few miles from now, a few miles from here, and then it'll be a mile from here, and then it's going to be a kilometer from here, and then it's going to be a couple of blocks from here. You know what I mean? It's going to get closer and closer. It's going to hit home soon. So just prepare yourself. That's all I'm saying. I mean, God forbid this, it happens, but at least you're going to prepare yourself. You're not going to go into panic, and get yourself like extra toilet paper, at least for a month's supply. Um, like I said, I've been preparing at least, it was a month. Now I prepared for at least 2 months. Okay. Now, the AHA regularly hosts webinars. Okay, Cliveria voice opinion seeks to provide relevant information. The hospitals of health and system, they're in the front line of preparing, in the front line. Some of them are getting very sick. A spokeswoman for the AHA told Business Insider in an email statement, the slides you shared reflects the various perspectives of field experts and should not be attributed to the AHA, the American Hospital Association. In particular, the side points the hospital should prepare for an impact the system 10 times the amount of flu season. In other words, be prepared for at least 10 times the amount. Maybe that's what this guy Lawler, this expert, was saying. Isn't alone anticipated widespread infection. Mark Lipschitz from the epidemiology professor of Harvard told the Atlantic he predicts anywhere from 47% of the people globally will be infected. I guess we're all going to be infected. It's just a matter of preparing yourself. And I'm going to buy a lot of ginger tea or oranges. I'm going to eat more. Blueberries especially. Greek yogurt, also another one. Probiotics, I think it's called. Probiotics in there. Dark chocolate, wild salmon. It's filled with zinc, or just get some zinc in your body. Broccoli. Okay. Oh, by the way, extra virgin oil is good too. Okay. It builds on the immune system. By the way, spinach too. Okay. Anyways, I should have a list there. God bless. I hope everybody took preventive. If you're watching my channel, it's been a month and a half already. I've been, sounding the alarm on this one here because of all the years, I don't know. We've never seen anything like this. I'm not an expert, okay? I'm not an expert, but just prepare. Just prepare. That's all I have to say. Don't panic. Just prepare. Calm down. You go out there, buy some extra, like I told you, just like I said before, okay. And God bless, Godspeed, and we. Oh yeah, by the way, I know in the Jewish world and all that, but the uh, I used to learn this in the past that my rabbi used to tell me all the time that if you want to prevent, diseases on yourself and your family, and give tzedakah, give charity, that would prevent in the other world. If you're a spiritual person, you would believe it. If you're not, that's another story. But I do. So give extra charity. God would see this as, a show of chesed, a show of, kindness. And it says in the, it's not in the Bible, it's in the, in the Gemara, which is the oral law. In the oral laws, I'll look for it. Maybe I'll do a video on it. Maybe I'll put a link on it here. It says it was a story with Rabbi Akiva, whatever, this rabbi, and they were talking about giving charity, and it prevented someone dying and all that. So give extra charity. That's all I'm saying. Give extra charity. If you give $10, give 20, whatever you can afford, and that will show kindness, and hopefully maybe this all will go away. Okay, take care. God bless.